It's Monday, August 8th, 2022. I'm Jonathan Lau, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today we're going to look at an article that is entitled Ozone Therapy for Dermatological Conditions, a Systematic Review. It comes to us from Brazil and was introduced into the Journal of Clinical Aesthetic Dermatology in 2022. So very new study, which is why I chose this one. For the most part. And so let's jump in and let's take a look at what they saw. Some good, some maybe not so great stuff here. So I want to jump into both of those things. First of all, these charts are helpful. They show what different administration methods were used and how they used them. In particular, a chart later on will do a good job identifying some of that stuff. So this is just showing you how they selected which articles they selected. So not something we're going to spend time on. But I want to note this. In this review, 12 trials used ozone therapy as a topical agent, ozonated oil, or immersion in hydrotherapy with ozone, ozonated saline or ozonated fluids of some sort. 5 trials used ozone bags, so limb bagging, and 1 trial combined topical use with ozone limb bagging, subcutaneous, and rectal insufflation. So a few different methods together. 1 trial used major autohemotherapy. Well, it actually just says autohemotherapy, so not sure which autohemotherapy. Okay, so benefits reported for acne were reduction in the inflammatory process, and for dermatitis were reduction of size of lesions and prurigo. Not sure what that word means. In psoriasis, the therapy reduced painful states, enhanced circulation, and the immune system. In systemic sclerosis, it aided in early healing and enhanced joint mobility. For herpes zoster, it significantly reduced duration of, and we have to jump way down here to see what it says, the pathological condition. And for ulcers and scarring, it helped with the repair and regeneration process, increasing blood circulation and combating bacteria and infectious agents. Let's jump back up real quick and let's take a look. I just want to show you these charts. So there's 2 very significant charts. Now, keep in mind that there was, I think, over 300 articles that they chose from 2021 that they reviewed or at least included in their initial search for articles on topical ozone treatment or for dermatological conditions, and they narrowed it down to 17 articles that were ones that met their criteria. So from 300 and some down to 17, and of those 17, these charts come from those 17 articles. So if you look at it, they'll have the author, the condition, the type of study, randomized trial, number of patients, group control, and intervention group. So what they did, how they treated it with ozone. So you can take a look at those, and then they have here the concentration, the total sessions, and the conclusion from each report, and risk of bias. So they're looking for quality of study when you do a review. And one of the things they note, and we'll look at just in a second, is that there were some things missing in many of these studies that should be in a study that's going to be peer reviewed and that's going to be highly quality controlled. According to Wang, ozone therapy is recent in dermatology and can be a complementary therapy for skin conditions caused by bacteria, virus, fungi, yeast, and or parasites because it acts on the inactivation of these microorganisms. So there's some studies or some proof that shows that. Here's some cautions. Very low concentrations are practically useless. This is one of the concerns in some of the studies, that maybe other people who are studying this aren't using the correct concentrations. And very high concentrations may provoke a negative effect, such as ill-being and fatigue, and even severe adverse effects like lowering the pulmonary function and dyspnea, among others. Okay, so there are concerns if we go too low or too high. Considering the information and methodological evaluation of the studies included in this review, it is still not possible to support an evidence level of ozone therapy for treatment of dermatological conditions such as acne, dermatitis, psoriasis, or herpes, systemic sclerosis, and aging. So that was kind of their conclusion, I guess, along with this. More research is needed under better methodological standards with dosage and ozone concentration reports. So here's the bottom line. When we look at studies, we need to be aware that some of those studies use very high quality control measures to ensure that the study is unbiased and that it is going to be legitimately qualified to be included in a review like this. And there's other studies that are done that really don't meet those criteria. And so with ozone therapy, we need to continue to search for studies that are of high quality and will be looked at by the medical community as a whole, regardless of the nation, as legitimate. Well, this has been 5 Minutes of Proof. We look forward to seeing you next time.